Sarcomatoid mesothelioma is an aggressive and rare form of malignant mesothelioma cancer that develops from mesothelial cells in the linings of tissues and organs in the body, usually in the pleura surrounding the lungs or in the peritoneum lining the abdominal cavity. Given its invasiveness and resistance to standard therapies, there is significant interest in exploring alternative and complementary treatment approaches for sarcomatoid mesothelioma. While more research is still needed, some alternative options that have shown promise either alone or combined with conventional treatments include: hyperthermia therapy involves raising the temperature of tumor tissues to damage and kill cancer cells. Heat applied either externally or internally has been found to make some chemotherapy drugs and radiation more effective against cancer. For sarcomatoid mesothelioma, localized hyperthermia delivered via probes inserted directly into tumors under image guidance is being studied alongside chemotherapy and radiation. The heat is thought to interfere with tumor blood flow and oxygenation to sensitize cancer cells to these therapies. Early research indicates hyperthermia may improve overall survival when added to standard first-line chemotherapy for advanced malignant pleural mesothelioma. Immunotherapy holds promise for sarcomatoid mesothelioma given its ability to stimulate the immune system to attack cancer cells. Checkpoint inhibitors like pembrolizumab that block immune-suppressing proteins PD-1 and PD-L1 have shown a response rate of around 15% in advanced mesothelioma patients after failing chemotherapy. Combination immunotherapy using different checkpoint inhibitors or adding them to chemotherapy is an area of active investigation. Adoptive cell therapy using natural killer cells or T cells genetically engineered to target mesothelioma antigens is also being assessed. Preliminary findings indicate this approach may stimulate an antitumor immune reaction with acceptable toxicity. Further clinical trials are still warranted to optimize immunotherapy regimens. Targeted molecular therapy aims to inhibit specific genes or proteins that drive tumor growth and progression. Mutations in the BAP1 tumor suppressor gene are common in malignant pleural mesothelioma and linked to more aggressive disease. Experimental therapies targeting BAP1 or downstream pathways impacted by its loss are in early testing. Additionally, drugs inhibiting the hedgehog, PEEK/AKT/mTOR, and EGFR/MET signaling pathways implicated in mesothelioma pathogenesis are being studied individually or in combination with chemotherapy. Data so far suggests some molecularly targeted agents may provide clinical benefit for subsets of patients. More biomolecular profiling is needed to identify the best treatment matches. Oxygen and ozone therapies are frequently utilized as complementary approaches. Hyperbaric oxygen therapy delivers 100% oxygen in a pressurized chamber to enhance delivery of oxygen to tissues including tumors. This may increase sensitivity to chemotherapy and radiotherapy by oxygenating hypoxic cancer cells. Similarly, ozone therapy uses medical-grade ozone gas administered through intravenous injections or insufflations to increase tissue oxygen levels by stimulating red blood cell production. Preliminary animal research indicates ozone therapy combined with chemotherapy slows mesothelioma growth more than chemotherapy alone. Both oxygen-based modalities are generally well tolerated with minimal side effects when done correctly. Nutritional and antioxidant supplementation may offer supportive benefits. A healthy diet high in vegetables, fruits, whole grains, and omega-3 fatty acids from fish is recommended. Specific supplements like vitamin C and D, selenium, and medicinal mushrooms like turkey tail are often included due to their antioxidant and potential antitumor effects. Curcumin from turmeric also shows immunomodulatory and anti-inflammatory properties relevant to cancer. While dietary changes and supplements alone do not treat cancer, maintaining good nutrition helps support the immune system during conventional therapy and mitigates side effects. More research is still warranted, but nutritional therapies are low risk and may enhance standard treatment efficacy. Traditional Chinese medicine modalities like acupuncture and herbal medicines offer multi-targeted and less toxic options. Acupuncture aims to restore balance in bodily energies disrupted by disease. Early evidence hints it may relieve mesothelioma-associated pain, chemotherapy side effects and support immune function when combined with oncology therapies. Herbs commonly used in mesothelioma include Astragalus membranosus to enhance immunity, Curcuma longa for its anti-cancer properties, and Prunella vulgaris to counter inflammation and swelling. Well-designed studies are needed, but Chinese medicine strategies are gaining interest due to multi-component effects and minimal adverse reactions compared to many pharmaceuticals. While surgery, chemotherapy and radiation remain standard initial approaches for sarcomatoid mesothelioma, emerging alternative therapies offer promising adjuncts and additional options when conventional treatments fail or cannot be tolerated. Most alternative modalities entail limited toxicity and can easily complement mainstream care. More research is warranted, but integrating complementary and integrative strategies within a multidisciplinary oncology framework may lead to better patient outcomes and quality of life. A team-based, personalized approach considering all reasonable therapeutic possibilities gives hope to individuals facing this difficult cancer diagnosis.